My name's Mumba Francine. I work at the facility, Kaunga Health Post. I'm a nurse there. I'm really, really happy and grateful to Solidamed for building this house for us.
Francine lives in Kaunga, near the Mozambique border. In the first year of her job as a nurse, her accommodation was bare, with no water or power. Then finally she could move into one of over 100 houses for health workers that Solidamed has built in recent years.
We have a very big housing deficit in Zambia. So Solidamed, and through working with Solida Invest as a subsidiary, is actually providing this solution to the housing gap that exists in the country.
Richard Mwape and Nzila Lubinda manage the housing project for Solidamed in Zambia. They know that it's crucial for improving healthcare in the country.
Housing is a key motivating factor for health workers to actually stay in the rural areas. So if you say a health worker is given an option between a better salary, education and housing, to stay in a particular place, they'll pick housing.
It certainly was a key motivating factor for Francine Mumba.
Considering that this is a bush, we have wild animals going around, but with this that has come here, I think I'm more comfortable and I can provide my services even better than I did before.
Indeed, despite Solidamed's successful efforts, the housing gap is still large.
Solidamed recently did a study where we have 35,000 houses which are needed for health workers.
But besides the scope of the challenge, the team at Solidamed sees lots of opportunities.
One, green housing, because we don't just build any house, we build housing that is sustainable.
The efforts for greener building include the use of local soil for the production of building blocks using a minimum of concrete, thus eliminating transport and minimizing carbon emissions.
We also see us getting into solar more. For example, we actually piloted a solar mini-grid in Katondwe, which is really reducing the power burden on the hospital. So we see us getting into that space.
Currently, there are a number of houses under construction, similar to the one in Kasisi.
This is where we constructed our two houses. It's a duplex. The same blocks that we saw from the other side are the blocks that we used. All our houses have got running water, and this is a quality that we assure our tenants to have clean water as well as the light.
The study revealed that 78% of health workers would take a rural job over an urban job if superior housing were available. One of the health centers that depends on accommodation for their personnel is the St. Luke's Hospital and Nursing School in Mpansha.
When the Solida Invest started building these houses, and when government sent staff here, and when we showed them the houses, they were very happy. And so we've been able to retain a lot of staff now. And now the hospital has 5 doctors. We've seen there's a great change. If there would be more houses built, more staff would be willing to stay and remain in the district.
Starting next year, we expect Solida Invest to be independent, operating as trading as Ubuntu Homes, meaning that it has to sustain itself, its full operation cost and any other cost that associates with the running of the organization.
So somebody who's looking to invest for impact, for example, just to see the benefit, can come in. It will change lives. It is already.